audience as well. I know I have to feel like I stand up
we understand. We've been going through it all week.
and say hello. So I just wanted to give you guys a few examples of some of the activities that I have done as a case-based scenario. And to start out, we could take a look and really identify what some of our assessment tools are that we may utilize for our students. And I think this varies significantly depending on your class, depending on the needs of your students. Do we do some assessment tools for our students based on those that are low performers? Do we maybe give them additional quizzes? Do we maybe have some practice-based examinations for them? I know I give some review questions and maybe some additional readings, but I think there's limitations of all of these activities. You know, quizzes, maybe you could build in some instructor feedback based on the response that they choose. Practice test, a lot of times maybe, you know, did I get this right or wrong, but I'm not exactly sure the reason why that answer choice is correct or incorrect. Review questions, a lot of time is just on the students to actually do some review as well. And then if you direct me to additional reading, I still may not exactly understand the content and the direction of what I need to for the exams. You guys that are on the virtual platform with us, if anybody wants to type in, let me know some of the content that you teach, I'd be interested to know who some of our audience members are, and I can hopefully kind of relate some of this material to you all as well, because it is applicable to pretty much any discipline that we are teaching or subject area. I'll give y'all a minute or two.
You're nursing. I'm nursing.
Oh, great. I'm glad we have nursing here.
Yeah. In fact, we were just talking about some dosage calculation software.
Oh,
tracking
excellent.
Some of that down.
So. Excellent. So nursing, instructional technology, literacy, accounting. Excellent. So if y'all, we can apply some of this information to you guys as well. When I look at our stages of learning for our students, what I wanted to focus on is I adapted this from a preceptor guide, preceptor development as it relates to pharmacy or any other health science profession. But we provide our students with some reading, with some lecture that really is that foundational knowledge. Hopefully they can comprehend this material as we guide them through the discussions in the classroom or some interactive lecture component. But really what we care about as far as the practical application, as far as the integration into patients or cases or activities are some of these higher functioning Bloom's activities and instructional technologies such as simulation, role-playing, practice-based teaching, case-based teaching, and case presentations. We all are very familiar with our Bloom's taxonomy, knowledge comprehension application, but what I'd like to focus on today is hopefully some of these higher levels such as evaluation, synthesis, and analysis, and how this particular activity may help capture some of these higher learning levels. I found this tool extremely helpful as kind of I think about a lot of my instructional strategies, whether it's in the practice-based application and rotations, or whether it's in the classroom, whether it's in small group activities. But some of these I hope are things that we're doing as we're flipping the classroom, as we're really engaging in more team-based learning, as we're engaging in a lot more of the discussions that we're having in class. But analysis, evaluation, creating some of these activities, I think, lend themselves well to some of the cases that we'll talk about, but others are extremely challenging to do and find time for. But the students, I think, are able to gain a lot of information from many of these activities. Bloom's has taken it, of course, to another level as it goes digital. So I thought this was very interesting from my aspect. I know I have not utilized a lot of these in these upper levels. I have looked at using iRubric. I've definitely been utilizing VoiceThread. I've utilized Prezi. I find it a little bit challenging and not quite as intuitive as our PowerPoint may be. But if anybody in the audience here or online, if you guys can comment on maybe any of these technologies that you've utilized for the analyzing, evaluating, creating, anything that you thought was helpful or that the students enjoyed. Again, helping kind of drive home some of those key concepts, giving them an opportunity to practice some of the content, really stimulating their creative or critical thinking component in the application. I find it extremely challenging to have time to investigate a lot of these, and so I think, sharing experiences in what others have used. I utilize survey tools a lot. I don't use them just to gain information from my students, but I use survey tools to actually have them do activities. So, for instance, if I'm having them evaluate a scenario or a case, then I want them to document their potential thought process or what medications they would order for the patient or what things they would change. I've utilized survey tools to kind of walk them through a stepwise process of kind of that critical thinking as well. Great, so wikis, Googles, polls. We use a lot of polls in the classroom. Wikispaces and Glogster. I've looked at using Glogster, so that would be interesting to look at as well. Flickr, great. Good to hear a lot of these, and I think this obviously is expanding significantly. So let me walk you through what we have done as far as I termed it or coined the phrase adventures in learning, but my students have the ability to navigate through an activity in what I feel is beneficial in enhancing their own learning. So when I have 200 students in a distance-based education, not all of them feel comfortable reaching out, emailing, talking in class. They may not even show up for class these days since we record all of our lectures. But when they get home and they're studying for that exam, they're thinking, oh no, I really don't understand this concept. So a tool that would kind of help highlight for them their areas of deficiency or help them identify why one decision may be more appropriate than the other. This was kind of the example that I chose. I hope everybody has read a Choose Your Own Adventure book. I loved them as a youngster, and I think I would go and reread every option to actually see how the character outcome would change. But it was very similar when I thought about the Choose Your Own Adventure. We're starting here at the beginning, and depending on the pathway, of course, they're going to get a very different outcome for their patient, or potentially also kind of get additional targeted feedback based on their specific action. The reason why I guess I became interested in this was virtual patient simulations, and this is especially in the world of not only nursing, medicine, pharmacy. It really is kind of the evolution of case-based learning. It is not cheap, and I don't have the funds or the money to buy this software, and we currently don't have that capability at our program. To find something that you can maintain yourself and really keep up with is extremely challenging. So I designed a free version in a way, and students actually have the opportunity to choose their own adventure as it relates to a patient case. So it is for them. It's very on-demand curriculum content in a very safe learning environment. They get lots of choices, and it's either a positive or a negative consequence based on the particular choice that they make. The students can, as I think we've already talked about, kind of test their knowledge prior to a high-stakes exam. And what I have seen in comments and feedback that I've gotten from the students is that they're able to engage in that case, really assess their knowledge of the material and apply some of the concepts that they've learned with me in class. I could highlight a lot of the costly options, and I will show you Smart Sparrow because I think it's kind of a cool platform that we could take a look at. But a lot of these other ones are a costly virtual patient software programs, very similar decision-making process, and potentially I'm sure that there are other ones out there depending on your specific discipline as well. But what I decided to do was take an interactive PowerPoint presentation, and so we all have utilized hyperlinks, some to a higher degree than others, but I have a lot of embedded decision-making scenarios. I have some recorded videos that I have embedded into that PowerPoint presentation. Maybe it's a snippet from a Khan Academy video, or a TED Med video, or any of the other YouTube videos, those types of things that may be available. But very targeted kind of direction in the videos. Maybe you're talking about an ethics option and you want to provide a little snippet of a patient, or of an actual voice behind that. So you can embed those types of videos as well. The key here is very detailed feedback. So detailed feedback for your learners. And I think the option for an interactive quiz is something that I'm exploring, but would help you kind of capture what they were able to take away and to learn, and hopefully kind of improve. You could do a pre-quiz, you could do a post-quiz, and kind of give you some feedback on the benefit of your scenario as well. So I chose a disease state in which, the pharmacist could play a significant role. I was talking to someone from public health who was doing a very similar activity, and it was more so an ethics debate. Something in which there isn't a clear right and wrong answer. There are probably several choices, but the key learning point is all of the real substance, the learning behind each of the decisions that are made. I upload this to Blackboard. What a downside would be is that right now it doesn't allow for student progress or graded assessments, but it is available and they can do it on their own. I highly encourage them not printing out all 50-something slides because they would get lost in all of the details, but for them to actually do it within Blackboard is the suggestion that I have for them. So if we visit and revisit the higher level, I highlighted in yellow how these activities are actually kind of hitting home on many of these knowledge levels. So the analysis, the decision-making activity that is built into this component, hypothetical scenarios, practice by doing, right? So this is a safe environment where a student can actually practice by making a decision and seeing the outcomes of that. Decision-making activities, we could kind of model a pro and a con approach. So if they chose this particular pathway, what would be the pros and the cons to doing this, and highlighting that in the feedback that you have for the students. Cooperative learning activities, I'm doing this individually, but they could easily do it in a group, and we'll talk about how you could do it in the classroom as well. Now, I already mentioned a little bit on the role playing, but you could have some pre-recorded videos, so not taking away from your class time, but a role play where you would record some role playing scenario outside of class and have this available for your students online or in the classroom as well. So let me show you guys an example. I'm going to grab the other document here. So the content is specific for a medical focus, but it could be many topics. So this would be a complex patient that gets a bacteria in their bloodstream and develops sepsis, and they are in the hospital. Branch-based tools are built into the patient case, and the student is posed with, based on this particular individual, I like to embed pictures so that it kind of drives home and it makes it more realistic and who it is that they're actually thinking about in their decisions. But here's a patient and here is a video. So if they had or wanted to kind of remind or refresh on what the definitions were, I don't think it is playing specific in Adobe Connect, but it would be able to play a video here when they were pulling up the PowerPoint. So which activity or which scenario would the student choose? Well, if they chose A, they thought that was the correct answer, I give them a very specific explanation as to actually there's probably a better choice. And so try again, go back a different route, and this time you are choosing the correct answer. I could go down a lot of different directions, and there's a lot of choices, but particularly depending on whichever avenue they chose, they may be directed back to that decision process, or they may be posed with additional questions. And so this would be an example. For this particular patient, you know, their decision may impact their mortality or kind of their length of stay. So I think it drives home the point of the importance of the decision-making process as well for our particular student. I'll show you guys a few tips that I have in creating the PowerPoint when we get to that, but I just wanted to show you a quick example of how this was built and how it provides the student with kind of a more individualized learning tool. Uh-oh, sorry, grabbed the wrong one. When I think about some of the successes, I've talked to some of my colleagues about this and also talked to the students as well. I highlighted a couple of successes. It is adaptive. It is adaptive for the content. It is adaptive for the learner. It really adjusts based on that student interaction, allowing the learner to create their own learning pathway. It's very interactive. So we were talking earlier, students are loving games. If we could create this into a game, I think they would love it even more. If they get points for, you know, choosing the right avenues, and you have kind of a challenge within the class, I'm sure they would love that and feed off of that as well. But the interactive hyperlinks, and I think the components that really drive home the real life scenarios help to make that interactive as well. The real-time feedback. What I hate is students leave the classroom, they have an idea in their mind, and they potentially may make it to the exam without having an opportunity to kind of provide them with some feedback about why maybe that specific thought is not exactly correct. So if we can reinforce very good recommendations, correct wrong ones, and not utilize all of our faculty time by having to answer questions or emails from 190 students across 3 campuses, it is an option that provides them with some feedback on their wrong choices as well, and hopefully kind of explains some more important concepts. Through active learning, it improves kind of their clinical competence, and these students can problem solve. They are not memorizing, but they are really applying the material to an actual scenario. So the student comments, they really enjoyed it. As soon as we were done, they said that they watched or went through the activity and actually made wrong choices to make sure that it gave them positive feedback about the concepts that they already had in their mind. So they did it multiple times, and there was no requirements. They all, I think about 90% of my students all completed the activity just on their own. So they had very positive feedback. They asked me when I was going to do more of these. They thought that the cases were extremely helpful. I told them I would do more when I had time, right? So activity they felt was effective in really breaking down that material, making sure that they understood all of the various scenarios. They got real-time feedback, and I think they were much more confident walking into that exam. When they got done, they said, Dr. Dunn, I remember exactly, you know, through that scenario, I remember how the decision that I made in the exam really was highlighted throughout that scenario. So I think they were able to leave with some increased confidence in the subject matter. It'll be a test 2 years later when they come to my rotation if they can still remember all the ins and outs of sepsis, but they get more quizzes at that point as well. I don't have a whole lot of exam performance, and I hope to do some more as I adapt this to some other material. but when I looked and compared, it's hard to compare apples to apples. So I'll continue to kind of assess this. Some of the questions improved, and I wasn't actually testing all of the exact same questions. I had 4 or 6 additional ones, so I was only able to kind of assess these 4. Future direction. So I would love to get your thoughts, your opinions, but I think there are so many avenues with this. We can embed some patient recordings depending on kind of the choice. We could recreate so many other topics and implement it in many other courses. I think we could refine the content for low performers. So if somebody is not doing very well, maybe you just have an extra opportunity for them to go through something similar and maybe get some extra credit points based on their direction or their performance. Or maybe just utilize some out-of-class assessment activities to help drive home some of the key content or core concepts for those low performers. I'd love to investigate an online platform, but resources are limited as it relates to this. And I'd also love to look at assessment of the intervention and more so the student perceptions. And I will be taking a look at that throughout the spring, specifically as I embed more of these into some of the core content that I have. I loved that I got some suggestions, and I have to say that I'll be watching the Adobe Presenter presentation and getting the handouts out here for this as well. But really learning how Adobe Presenter, I think, could actually do this for me. And so embedding Adobe Presenter, this PowerPoint presentation for sepsis into Blackboard, having quiz-based functionality in those videos throughout that particular component, I think will really enhance this activity for the students. Great, so articulate, storyline, or captivate. Wonderful to hear that. And so Adobe Captivate I'm looking into as well. Again, I would love some feedback as I interact with others for potential options or suggestions that they have. Another activity that I'm considering is you have a complex question that you're posing to your students. And we often use audience response systems, but from where I see audience response systems, we're getting one question posed to the class. But if you take this activity and you bring it into the classroom and you're asking the class to vote on a very complex question or subject, you choose, you identify what the majority wants to do, and you walk through that scenario in class. So you're taking that activity and actually bringing it into the classroom. It could be similar where they could do it in groups as well and have to discuss and come up with the reason, the rationale why they went the direction that they chose. Maybe there's a reflection that goes along with it as well. So how did your group come up with the decision? You know, what were some of the strategies that you guys utilized? And hopefully allow them to kind of engage in that material. I found a few interesting options. I don't know about you guys, but depending on the complexity of this scenario, I think your mind starts getting really confused. And so I had a lot of pieces of paper and I was laying them out as to what direction we could go in. But I wanted to show you guys a few of the mind mapping tools. I'm not sure if y'all have utilized this at all, but hopefully I'll share.
Just hit Firefox.
Excellent. But if we take a look at this, I found a couple that were suggested to me, but Mindomo would allow you to kind of create a mind map. So you have your initial question, depending on the direction that the student chose, you can actually kind of lay out and make sure that you're bringing in the key concepts, the key core components, and all of the learning points associated with this. So that was pretty interesting. Again, something that doesn't take a lot of our time, but maybe it just helps you stay organized. So what exact PowerPoint slide am I linking to, and if you have some content and you have some specific topics here, that would help. Here's another one, so bubble.us, but again, you could create very similar. You could describe a process, you could branch it off, or maybe just grow your idea in different areas. Toggle is part of Google, and so I kind of like the layout of this. It can go in so many avenues and so many directions, and it is all pretty quick to do as well. There's some mind map, mind map, and these were very neat, much more realistic as far as pictures and scenarios go. So those were 4 examples. I'm not sure if you guys have used any of the mind mapping at all. And we'll give it a try as far as getting my thoughts together and organized as I move to some of these more complex topics.
And all of these were?
They're all free.
They're all free?
Mm-hmm.
Okay.
The ones that I showed you are all free.
Okay.
I had to go with the free options when I can. The ones that work, the ones that are effective in their technology. But
were they not robust enough to do what your object does? Is that the reason why you chose not to use them?
So she was asking about kind of the robustness of those. When I was thinking about those were more for me to organize my thoughts and make sure that I would be able to cover all of the content and make sure that I understood the direction and the branching that the scenarios could go.
Okay.
And so to answer your question, it was more so just for my organizational structure, where I could refer back to it and say, you know, maybe there's a new scenario that I didn't think about, and if I add that branch to this particular option, you know, I could quickly kind of rearrange my PowerPoint links. I'm a visual person, so, you know, having it all in one place, I was just kind of thinking about that.
Okay.
Smart Sparrow is something that really takes exactly, I felt like, what I was doing into a smart online environment. You can get a free individual account, and you can share it with colleagues, and you can share it with 5 students. But besides that, you'd have to purchase a software or purchase the component. So let me show you guys what that's all about. Hopefully you're following along as I switch back and forth. But the benefit of Smart Sparrow would be this analysis component. So what you have is how many students really did this activity? What was their performance? And what direction did all of the students choose? So this advanced analytics, where it shows you, well, the vast majority actually went the wrong direction. And this was the direction that they chose. They got to the right scenario eventually. But a high percentage of your students were actually choosing, you know, the less desirable route at first. When you come back to class the next day, maybe you could highlight what are the key take-home points. Why were so many people choosing that particular direction? So here's an example of a Smart Sparrow activity. This is an interprofessional case, and the other benefit is that it would score the students. It tells the instructor how the students performed on this. So you can navigate through the lecture. Now I'm ready to get started. I want to learn all about this particular case and try it out. I'm from a pharmacy perspective per se, but maybe it could be a nursing student or a medicine student. This is very complicated, but kind of taking them down the route of the pharmacy pathway. I'm a pharmacy student and want to move forward, and here's my case. So who is this patient that I'm actually presented with? I read some information about him. I find a little bit more about kind of his past medical history or his complaints. I'm asked to do some calculations, and do I get those right or wrong? I was not correct. But you get the point that you can actually proceed. So this is a much more advanced tool than what I'm using in the PowerPoint. And again, it would cost based on the number of students that you're interacting with. But it's one that I found that provided a lot more in-depth opportunities. Poll Daddy allows for branching. Poll Everywhere is a feature in PowerPoint 2013. I'll have to learn more about that. Y'all are teaching me all kinds of great things. Love it.
I didn't even know the polling ones did that, so I've got to look into that
I know. Great. I love when I can take home more things than than I came with. Absolutely. Does anyone have questions, thoughts? Is this anything that maybe you have considered? Again, like I said, I was actually watching a webinar the other day, and it was on clickers. And so there was a colleague on the MUSC campus. She was doing this exact same thing. I reached out to her and said, how can we kind of talk about totally different discipline, but how can we talk about the application? She's using PowerPoint as well, but maybe if we could collaborate on some scholarship, it would help our students kind of in an in-class versus out-of-class environment, help us see what the potential is for those activities as well. Any other thoughts that you guys may have as far as any branching options, anything similar that you've seen in your classrooms that your students may enjoy, any potentially gaming functionality from this that is something that we could do on a low budget type option? What do you know about Articulate, Veronica?
I've seen it in action.
Uh-huh.
I just haven't had a chance to play with it
Okay.
yet. But it produces some pretty robust learning objects. And the guy on Friday who's going to present on Friday at noon, at noon, he's probably going to show some examples of what it did on the back end. So,
okay.
I definitely have you at the top of my brain to figure
out,
how and what
from
do it at low cost.
Yeah, and I think as we look for, I think here at USC, it's wonderful. We've got grant opportunities to kind of search out new technologies that may really be beneficial. But looking at the sustainability of those as well. So, our struggle a lot of times is, well, if it's dependent on the number of users, will your users change each year? Or we have 3 campuses and we've got 190 users. And so those costs really add up. I think they provide extensive learning opportunities and benefit for the students. And so trying to find the balance from the faculty time and creating some of these activities, if it's material that you can continue to use with minor tweaks, I really think your time and the investment is well worth it if your students are gaining substantial benefit as far as their critical thinking and their analysis and their application. I think that is key. Great. Well, does anybody have questions? Anything thoughts that you may have? I really appreciate all of the suggestions as well. Like I said, I really think this material could be applicable for a variety of students, for a variety of graduate, undergraduate programs. Just finding that controversial topic, that debatable topic, and providing some insights into that. VoiceThread, I don't know, I haven't really thought about it, but if you go down and have a direction based on which direction a group chose, maybe they could put their comments into that about why they chose that particular direction or avenue for that scenario. So I think it could be a two-way street as well as far as the interactive component, if the students could provide some comments to the other groups. So just thinking about application, I think there are a variety of options.
How much information did you get to see whether or not what you created could be duplicated in Presenter? Did that seem like a viable option for you?
Yeah, absolutely. So
Okay.
I'm having to learn Presenter. We do Adobe Connect for recording of all of our lectures, and we use Camtasia as well. And so nobody really in my program is using the Presenter very much, but I really think the feedback that I got from it, I do think it would be a viable option. I think it would provide me with some of the assessment tools that would provide some interactive quiz-based components. So maybe not them answering content questions, but more so feedback and the assessment from my end. So every intervention that I'm doing in the classroom, what is the feedback from the students? What would have made this activity better? What would have really enhanced your learning? Did you appreciate this activity? So maybe some of those assessment tools is a quiz-based component that could guide in your development as well.
The way you have it set up right now in the PDF is merely for self-assessment purposes. It's not being tested.
Yeah, so I talked with Veronica that when I uploaded the document, I saved it as a PDF with one slide per page, and I could have uploaded the PowerPoint. I'm used to providing students with a PDF document, and so I just uploaded it as that, and the hyperlinks all still worked. I could have uploaded the full PowerPoint and gotten the same component, and I think that would be the benefit of Presenter. It's within a PowerPoint kind of platform and allows for the students to walk through their scenarios and I guess have some videos that are there and also some quiz-based functionalities.
Okay. So, but the way
So Veronica, I'm not sure that I would continue to use PDF. I think it was just, I don't know whether I just didn't want my whole 50 slides out there for the students.
Yeah, I don't think you should do that either. I think I'm thinking more along the lines of right now they're just using it for self-assessment purposes,
They
right?
are, absolutely.
Okay. So if you found a way to embed quizzes that could be SCORM compliant and graded through Blackboard, that's your goal right now?
Maybe.
Okay.
I think the downside to the class where I utilize this is it's a huge team taught course, and so all of their grade comes from their exams.
Okay.
And so a quiz and a grading functionality isn't going to provide me any benefit in the long run, with the exception of just gathering some assessment data for myself.
Okay.
So how did they do overall? Did it maybe help with a pre and post type quiz? So if I asked them to answer 5 questions, do the activity, and then re-answer those questions, did they improve in their performance? And so I think for now I'm just looking at some component that I can capture from an assessment. In my small classes, in my elective classes, of course I have a lot more flexibility with quizzes and those types of grades and how their final grade is calculated.
Okay.
Yeah.
Winona, do you know if articulated SCORM compliant?
You can score it and actually used to they hosted it free, but they got the site. Oh, so I know that it'll go there.
And not in Blackboard.
Okay. Yeah, and again, I have to go through kind of the details, but I think Presenter did allow that functionality in Blackboard.
There's an answer for you, and I'm going to figure it out. I'm not going to rest until I figure it out.
Well,
there's too much out there for this not to work.
Yes, absolutely. So really, it's thousands of dollars from any of those other platforms, and
No.
and my students have really been appreciative of the of the learning and the knowledge that they've gained from this. Um, it's very similar to where I am on rotation. They see the patients and they can very easily apply or it resonates with them, and they're able to kind of recall and remember the key components as it relates to application. But in the classroom, it's really hard to give them a lot of scenarios and help them visualize what it's like when they get out there in the real world. So kind of trying as best I can to bring that application, real world application, to an activity.
There's Hyper Studio. Keith thought they had done away with Hyper Studio, but there's a version 5 out here. And this website is up to date, so it's called Hyper Studio 5, and what it does is creates interactive digital presentations. And you can do something similar to what you did in your PowerPoint and do those branching and case analysis type of activities. I remember using it in undergrad, which was back in the early 2000s, and I couldn't imagine that they would have done away with it. But according to this, there's a Hyper Studio 5 version.
I did want to show you guys just I wanted to show you guys a few tips that I have when I'm creating those PowerPoints. And I'm going to have to, Veronica, to get to my PowerPoint without being in, so I want to be in PowerPoint, actual PowerPoint. So share your
screen. Document.
No. Because it won't show me the behind the scenes.
Oh, okay. Share your screen. Share your screen. And then.
There we go. And I'll just open it.
Okay.
Got it. Okay, guys. So one thing that I wanted to show you as I developed this is if you take a look at a few of these scenarios, what I have done in the setup is I used the same similar outline where the heading I actually move off of the screen. So the students never see that. But what it allows is that when I embed, say for instance, I want to insert a hyperlink. I wish I was the Mac user. Is I insert hyperlink. What you can do is actually within your document, when you're actually selecting to locate, by doing that, all of your titles are there. And so it was a huge kind of time-saving component for me. And so otherwise, if you don't have that heading, then all of these show up as slide 1, slide 2, slide 3, and then you get lost as you are trying to navigate where exactly the link goes. So if you actually went through, you're going to see that none of my headings are visible to the students, but it serves as my navigation piece. And that is how I quickly kind of add those features. And then I use my same images where, I'll kind of drag and copy over this ABC and many of the same maybe box components, so that I'm not recreating everything, but just kind of copying over some of the same. Yeah. So the suggestion, is making that a template, absolutely. And that was, I think, one of the tools that I utilized in how to create a template for that component. And so trying to cut down on your time, if you're going to do a couple of these, trying to minimize the time that goes in by having some of that templated functionality would be great. And I don't know, I had to learn, and you guys may be familiar with this, but of course, a little quick Google tells you if you want to embed a video um, in here, and it's a YouTube video, you can put in here specifically, embedded in here, where you want it to start and stop, and whether you want it to have autoplay functionality or not. So in a little Google search, I was able to figure out I don't want the whole YouTube video, but what if I only want 15 seconds and that to be the only component that is shown? Then you can adapt and kind of revise a lot of this down here as well. So that was just a quick, you put the start and the end time, and whether or not it wants to be autoplay would be a 1 or a 0. So I did not want it to do that. I wanted them to have the option to click on that if they chose to do so. And so again, not sure why it wasn't working here, but it worked in the PowerPoint version for the student. So those are my quick tips as I create those. So you're creating the hyperlinks within the scenario, but I really think that header saves you a good bit of time and helps with the navigation piece as well. Yeah. I have to learn more about accessibility and compliance as it relates.
And your home button at the bottom right takes them back to the main first slide.
So the home button is specific. So here, this home, because the response was wrong, this home would actually take them back to the question.
Okay.
But it depends. So, I tried to differentiate always that a check mark was the right answer. Move forward, keep going.
Okay.
But others, if they chose this antibiotic first, then it's going to pose them with additional questions. They don't get an option to go back, and unfortunately, their patient de-escalates and worsens, and they have to restart from the very beginning. So you can build the algorithm and the branching however works best for the content that you're doing. Okay. At the end, what I found, I just tried to, everybody ends on the same slide, but I said, don't forget about these. We didn't cover these in this scenario because they're not as controversial, but don't forget about adding these, getting rid of those medications when you can. Let me know if you have questions. And so just kind of wrapping up and giving a final conclusion for them, as well as the way that I think everybody would end up on the same slide and kind of drive home a few additional points.
Okay.
But it's totally up to your creative option, however you choose to design that activity. Great. Well, I really appreciate all of your ideas and your feedback. I hope this is at least the concept, potentially something that you guys could utilize in your classroom. Again, probably not for every class and probably not applicable for every piece of lecture, and probably not every subject matter that you're teaching. But I think it could be applicable, especially as the learners are a group of students. The way that they learn and the push to be critical thinkers, I think it allows the opportunity to really apply the information to a particular subject matter, debate, talk about some of the pros and cons, and force them to come up with a particular decision.
Can you speak to the time commitment to create this, starting with the storyboard to finish?
Yeah, absolutely. So the time. So I think when I started this endeavor, I had to go in and I did, a few quick little YouTube videos. How could I make a template in PowerPoint? I'm one of those that usually am and kind of learning along the way. I have tons of ideas and then try to reach out and find my resources that can help me achieve whatever those goals may be. So a lot of this was independence on my own, figuring out the importance of the direction and the content. I had to write down all of my ideas, and so I think the initial time was several hours in getting everything finalized. It really helped to outline and have a thought in place, what the different scenarios, which direction they would go, and then I could just kind of type that information in. It was a patient case that I could adapt that I had used in a previous scenario, so I was just taking that patient, doing a lot of branching within it, and so I wasn't recreating a lot of those labs. And now I'm pretty quick in hyperlinking various things, and I do it all the time in some of my presentations, depending on the direction that the audience may want to go in. So I would say with time, everything in practice, you become a bit more efficient. But I definitely spent a good portion of the day focused on this, trying to get everything finalized. But once it was done, very easily adaptable for future years as well. Well,
Any more questions for Dr. Dunn?
y'all have other thoughts, other suggestions? If you need some tips along the way, I'm always absolutely happy and willing to share with you any of the information that I have learned. I'm going to always thank Veronica for being one step ahead of me and even thinking about other alternatives. And hopefully y'all have some success. I am going to try the Adobe Presenter for the spring. So I'm already kind of working on the specifics of that.